Welcome students. Now we are going to study about the causes and effects of stress. The world today is full of tension. Wherever we go, we find people are tense and nervous. Stress, tension is more common than cold or cough. Stress is a fact of life and can affect individuals in a variety of ways. At some point in life, every individual experiences some degree of stress. Some individuals experience stress more often than others, and some have difficulty dealing with stress. Stress can be manifest from any situation or thought that causes an individual to experience frustration, anger, and nervousness, whereas anxiety is a feeling of fear and apprehension. Form of stress. According to the American Psychological Association (APA), stress can be categorized as acute, episodic acute, and chronic. Acute stress is the most common form of stress and is short term. It is described as a reaction to an immediate threat, commonly referred to as the fight or flight response. Common causes of acute stress include noise, danger, crowding, or isolation. Episodic acute stress is prevalent among those individuals whose lives are constantly chaotic and demanding. These individuals are always in rush, tend to take on too many tasks at one time. Individuals who worry a lot also prone to episodic acute stress. Chronic stress. Chronic stress is defined as a type of stress that occurs over a long period of time from either internal or external stressors. Common causes of chronic stress include financial problems, death of loved one, long-term relationship issues, or having a demanding job or work schedule. Common effects of stress. Indeed, stress symptoms can affect your body, your thoughts and feelings, and your behavior. Being able to recognize common stress symptoms can help you manage them. Stress that's left unchecked can contribute to many health problems such as high blood pressure, heart disease, obesity, and diabetes. Common effects of stress on our body, on your mind, on your behavior. Headache, create on your mood, anxiety, on your behavior, overeating or undereating. Some of the tables for your study given here. You studied well. On your body, common effect: headache, muscle tension or pain, chest pain, fatigue, change in sex drive, stomach upset, sleep problems. In the behavior, you see the table you see. Type of stress, good or bad. Some stress get you going. They are good for you. Without any stress at all, one may become lazy and our lives will become boring. However, when stresses undermine both our mental and physical health, they are bad. Stress performance connection. You see the graph. Some optimal level is needed for the life improvement. You see, the performance is optimal level, stress is important. Low level became sleep, and high level is a fed up. anxiety and fed up arise in this place. Effects of stress: body, mind, behavior, emotion. You see the body: breathlessness, headache, frequent infection, fatigue. Body, mind, worrying, impaired judgment, negativity, nightmares, hasty decisions. Behavior: insomnia, restless, accident prone, loss of appetite, aggression. Emotions: loss of confidence, fury, irritability, depression, alienation. These are effects of stress. Causes of stress. Causes or factors of stress are known as stressors. There may be responses in the human being due to the felt stress or inner pressure state. It can be of two types: body response, psychological response. Moreover, stress is a big problem in the medical field as it contributes 75% of bodily disease. Stressors: physical stressors, that is called one's injury, infection, exercise, noise, climate. This is a physical stressor. Emotional stressor, it is from this frustration, conflicts, family, transition of life. It creates emotional stressors. Environmental stressor, social activities, health, finance, job, that create environmental stressor. Symptoms of stress: feelings, behavior, physiology. Feeling: the individual becomes anxious and is scared. The person feels that he has got something to lose or something wrong will take place. The person becomes irritable and moody. Individual develops a negative frame of mind and suffers from low self-esteem. The person loses faith in his capabilities and is afraid of the failure, not able to concentrate, and is involved in his own plans and thoughts. Physiological and behavioral changes: speech problems, impulsive behavior, crying for no apparent reason, laughing in a high pitch and nervous tone of voice, grinding of teeth, increasing smoking, and use of drug and alcohol, being accident prone, perspiratory, sweaty hands, increased heartbeat, trembling, nervous tics. It is this is physiological problem there. Dryness of throat and mouth, tiring easily, urinating frequently, sleeping problems, diarrhea, indigestion, vomiting, nausea. These are problem in this area. Butterflies in stomach, headaches, premenstrual tension, pain in the neck and or lower back, susceptibility to illness, loss of appetite or overeating. Effects of stress: stress response disease, decreased immune response, mental illness. Personal stress as life events, personality. You can already the personality disorder. This personality disorder makes some stress. Cognition, conflict, lifestyle. Stress at work, sickness absence, high staff turnover, poor communication between teams, bullying, lack of feedback on performance, value on the contribution, technological change, lack of clarity of roles and responsibilities, dissatisfaction with the non-monetary benefits, working long hours, boring and mundane work, one-off incidents, uncomfortable workplace, lack of training. Changes in competitive society, emotional, complicated situation, difficult people, insoluble problems, fear of what will happen, aroused, changes in body chemistry that go to want to hit out or run away, cannot we solve hard, contain the feeling and sustain the stress not released. Effects of stress: impaired performance, burnout, mood disturbance, concentration difficulties, sleep and appetite disturbance, lethargy, other medical problems. Stress and illness: fight or flight response is inappropriate for 21st century life. Link between stress and illness. Stress and coronary heart disease. The Framingham Heart Study from the American Heart Association, Friedman and Rosenman. High cholesterol, hypertension, smoking, lack of exercise, obesity from the stress inducing these problems. Stress and cholesterol findings: accountants had higher level of cholesterol during tax session. Medical students had higher cholesterol level before finals. Military pilots had higher cholesterol level at the beginning of training and examination periods. Stress related illness: stuck in higher gear. Is it possible? Worry yourself. See, your body has hardwired self-defense system commonly known as the fight or flight response. The response is supposed to kick in when you encounter an immediate physical threat and turn off when the threat passes. However, your body can get stuck in fight or flight mode because of stress, and this can cause health problems. Illness caused by stress. Continuing, we can study about the various ills caused by the stress. Respiratory system, it is common in the stress. Common cold, it is here in the starting stage. The stress is every person having the common cold. The hint is congestion of nasal mucous membrane. Rhinovirus, this bunch is most active in early fall, spring and summer. They causes 10% to 40% of colds. You feel plenty miserable when you catch one, but the good news is they rarely make you seriously sick. Bronchial asthma, bronchial spasm there. Cardiovascular disease caused by the stress. Tachycardia, increased heart rate with irregular of the heart rhythm. Tachycardia is a condition that makes your heart beat more than 100 times per minute. There are three types of it. Supraventricular, this happens when the electrical signals in the organ's upper chamber misfire and causes the heart rate to speed up. It beats so fast that it cannot fill with blood before it contracts. Angina syndrome, sudden and severe pain in the chest. Angina is a type of chest pain caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Angina, also called angina pectoris, is often described as squeezing, pressure, heaviness, tightness or pain in your chest. Cardiovascular disease continue. Hypertension, high blood pressure. Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure is the arteries is persistently elevated. Coronary disease, heart attack. Coronary heart disease or coronary disease have developed when coronary arteries become too narrow. Coronary arteries are the blood vessels that supply oxygen and blood to the heart. Coronary heart disease tend to develop when cholesterol builds up artery walls, creating plaques. Gastrointestinal disorder. This is disorder caused by the stress. Anorexia nervosa. Anorexia, loss of appetite. Bulimia, excess of appetite. These people eating always bulimia affected patient. Peptic ulcer, it is common in stress person. It is an open sore situated on the lining of the stomach or more frequently on the upper portion of the small intestine. The peptic ulcer is common in stressed person. Colitis, inflammation of the colon. Symptoms include diarrhea, constipation, lower abdominal pain and bleeding. Migraine, headache. It refers to an intensity, painful headache recurring periodically on only one side of the head. Only one side of the head. Migraine headache. Genitourinary disorders. Urinary tract some problems because of the stress. Neurosis or bedwetting. Urinary incontinence. Neurosis is the loss of bladder control. In children younger than age 3, it is normal to not have full bladder control. As children get older, they become more able to control their bladder. Wetting is called neurosis when it happens in a child who is old enough to control his bladder. Bedwetting, we can see dono. Menstrual disorders. Premenstrual tension. It is caused by the stress. Premenstrual syndrome is a condition that affects a woman's emotional, physical health and behavior during certain days of the menstrual cycle, generally just before her menses. Premenstrual tension is a very common condition. Its symptoms affect more than 90% of menstrual women. Dysmenorrhea, painful menstruation. Dysmenorrhea is the medical term for menstrual cramps, which are caused by uterine contractions. Primary dysmenorrhea refer to common menstrual cramps, while secondary dysmenorrhea is result from treated dysmenorrhea menor. Psychogenic amenorrhea, stoppage of menstruation. Psychogenic amenorrhea result from the interaction of intra-psychic vulnerability, external stress and neuroendocrine disturbance. It may result from exposure. Disturbance of sexual function. Sexual dysfunction refers to a problem occurring during any phase of the sexual response cycle that prevents the individual or couple from experiencing satisfaction from the sexual activity. The sexual response cycle traditionally includes excitement, plateau, orgasm and resolution. Psychogenic importance for male. Psychogenic importance is where an erection of penetration failed due to thoughts or feelings, psychological reason rather than physical pathology. Frigidity for a female. Frigidity, failure of a female to respond to sexual stimulus, aversion of the part of the woman to sexual intercourse, failure of a female to achieve an orgasm during sexual intercourse. Mental health disorders, anxiety disorders, panic disorder, phobias is common in the mental health problem by the stress. Post-traumatic stress disorder, PTSD, is a mental health condition that is triggered by a terrifying event, either experience it or witnessing it. Symptoms may include flashback, nightmares, and severity anxiety, as well as controllable thoughts about the event. This event you can see the many more calamities, natural calamities, earthquake, tsunami, this is the cause of this stress cause. It make PTSD. Obsessive compulsive disorder, tension, worries from the it creates by the stress. Somatic form disorders. Following out somatic form disorder, conversion disorder, somatization, hypochondrias. Conversion disorder occurs when the somatic presentation involves any aspects of the central nervous system over which voluntary control is exercised. Somatic, soma means body affected by the disorder by the stress. Somatization, the manifestation of psychological distress by the presentation of body is symptom. Somatization. Hypochondria, the biggest problem you see, it cannot easily understand what is the hypochondria in the people who are affected by the stress. Obsession with the idea of having a serious but undiagnosed medical condition. Hypochondria usually develop during adulthood. Symptoms include long-term and intensive fear of having a serious condition and worry that minor problems indicate something serious. A person may frequently visit or switch doctors. Dissociative disorders. Dissociative disorders are mentally disorders that involve experience a disconnection and lack of continuity between thoughts, memories, surroundings, action and identity. People with dissociative disorders escape reality in ways that are involuntary and unhealthy and cause problems with the function in everyday life. Psychogenic amnesia, also known as functional amnesia or dissociative amnesia, is a disorder characterized by abnormal memory function in the absence of structural brain damage or known as neurobiological cause. Psychogenic fugue, wanders away from home. Dissociative fugue, formerly called psychogenic fugue, is a psychological state in which a person loses awareness of their identity or other important autobiographical information and also engage in some form of unexpected travel. Dissociative disorder, multiple personality disorder. Dissociative identity disorder, previously known as multiple personality disorder, some of the films you see, this is implied this, is a mental disorder characterized by the maintenance of at least two distinct and relatively enduring personality states. The illness is accompanied by memory gaps beyond what would be explained by ordinary forgetfulness. Depersonalization disorder, also known as depersonalization derealization disorder, is mental disorder in which the person has persistent recurrent feelings of depersonalization or derealization. Depersonalization is described as a feeling disconnected or detached from one's self. Depression disorder, a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment in daily life. Substance abuse. You can laterally we studied about this substance abuse in separate lesson. You can study. Okay, thank you, student.